is a dream for all of us in Saudi Arabia. And we know there are many patients roaming around in different hospitals, and they are, rotating for the same specialty from one hospital to another. So, and we know other patients, they don't have any file number. So today we have a leader in the country who I believe is, working hard to achieve the e-health in Saudi Arabia. Our next speaker is someone who has an interest in research, include developing and evaluating health informatics resources, application of information technology to health policy development, and health management. He is also a Vice Minister for Health, for Planning and Health Economics. So as I told you, he is one of our key people in Saudi Arabia. So I would like to welcome this moment Dr. Muhammad Al-Yemni. And Dr. Al-Yemni, I'm quite sure you will have a lot of questions at the end of the session, so please be ready and ask him for any question you need. Dr. Al-Yemni, please.
Okay. So this is the pointer. And how can I change the slides from here? Okay. Assalamu alaikum. Bismillah, salatu salam ala rasulullah. Good morning to you all, and thank you for coming. I didn't expect this large turnout during this inclement weather. It's very rare in Riyadh, but it is here, and it caused us a little bit of delay, so I apologize for my late entrance, but thank God that I was able to make it. When I see the crowd from where I came, it's very challenging. As Dr. Abu Abad has introduced, I'm not the Vice Minister, not yet. Maybe there is some news he has for me. I'm the Deputy Minister of Health. The two Vice Ministers are Dr. Khushaim and Dr. Al-Hawasi. I'm Deputy Minister for Planning and Health Economics, and that is a very exciting approach for the Ministry of Health. Certainly the e-health program that Dr. Abu Abda alluded to is partially the subject of our talk today, but also there are other areas, the planning and scholarship and the training and the research, certainly the research of the Ministry of Health, in addition to the other part of the work that I'm doing, which is the health economics. That's where the Ministry of Health is actually doing a lot of innovation, and I wish that in due time we'll meet with you again and talk about what we are doing in that area to kind of find the different resources to pay for the ever escalating and increasing healthcare cost. As a matter of fact, tomorrow we'll have a lead person who has a master's and PhD in economics and been the head of Director General of investment in one of the lead investment companies in the Gulf region, to start as Assistant Deputy Minister for Health Economics, so that he can help us with the manufacturing, with the innovation and the work of different areas to find different resources to pay for the healthcare that we provide to citizens and non-citizens of Saudi Arabia. As you may be aware, the national e-health program that the Ministry of Health is conducting now is a very innovative, very ambitious program. It's the Ministry of Health has made the very bold decision to take the entire country by one full program, but it is also was a very sober decision, started by choosing the right team, having the right support, and building the right strategy, and going forward to create a national network. And the aim of that network is to provide the health information of the patient in an electronic format at the point of care. That is easy said, but it is very challenging to do. And let me assure you that there is no country in the world so far, and I know what I'm talking about, that has reached this goal at this point. Because I see sometimes people kind of like ask me this question. They said, why haven't Saudi Arabia reached what other countries have reached by having the patient information in electronic format available at the point of care? My answer usually, I will say, well, what country is that? There are some attempts, others been more successful in that, but nobody had reached a 100%. There is a small country in Europe with a population of 1,500,000 people, and hardly the size of, of Manfuha here in Riyadh, that they are very close to having that done for them. But certainly their size and their population size is a major factor for them, but not yet. So we are on that road. We're trying to reach it. At this point, we have 251 hospitals in operation in Ministry of Health. We have 2,040 primary healthcare clinics, a number of specialty centers, cardiac, oncology, and others. And also we have to connect with the medical cities, largely King Fahd Medical City and King Abdullah and the King Fahd Hospital in Dammam and the eye specialist hospital here, King Khalid in Riyadh. But we are also building 100 new hospitals. And also we are building about 1,000 primary healthcare clinics. So we are challenged big time. We have to find now, I am responsible for that, also the Ministry of Health, for the next 5 years, about 60,000 physicians. And if you can find a way to get those 60,000 within the next 5 years, please make sure you get a hold of me before I leave today. Now, as far as the innovation in medical information and medical informatics or health informatics, let's talk about innovation for a second here. What is innovation for us? Is it doing what we are doing in a different way to kind of like affect our overall efficiency, either by reducing cost or reducing the time we take it or increasing the quality or doing all of them? Or is it coming up with a totally different way of doing things, as of to say, thinking out of the box? Or maybe, in such a case, when you are in charge with a major work, people do not expect you to spend a lot of time planning or going into different ways of learning or being intellectually challenged. They expect you to know what you are doing and to go by your way of doing it. As if to say, that is finding the way that works and go ahead and do it because nobody will wait for you. And that is the case. Where I used to come from, I used to be intellectually challenged. I used to challenge the people that are working with me, that I meet with them and I talk with them and I have the pleasure of teaching them whatever I know, and they have the chance also to educate me in whatever way that they think is appropriate given the subject matter that we're discussing. So I can't afford that kind of luxury, me and my team now at this point, because we are charged with a job to be done and there are time limits on us, there are budgets that will run away from us if we don't do them now. So how can we come up with a way, although we are in charge with this big project, with this work, this more than 12 billion, billion with a B, Saudi riyals worth of projects, and at the same time not lose track for the things that should be developed. Our idea was to create this center of excellence in e-health, where we will give chance for those enthusiasts among us to go ahead and try to develop different ideas, find different approaches, sometimes kind of like the crazy ones among us. And if you know any one of you that is crazy enough, please, we have openings. That we give them the chance to excel. And let me give you a very clear example here. Some of you may hear about the standards of exchanging information. The simplest example is that when you buy a new smartphone and you want to transfer the data from the old phone to the new phone, is that an easy job? Okay, thank you for shaking your head. It's not an easy job to do it, right? To transfer the data of your telephone from the old telephone to the new telephone. And you think it is easy, then think if you want to transfer patient information. And we have to remember a very important fact, that data outlive technology. So whatever data we are collecting today in King Fahd Medical City, the technology that store that data and exchange that data will be outdated one day, but the data will still be there. So we'll have to find a way to migrate that data and maintain its integrity. That is a very difficult job. Now, when we are exchanging the information, and those of you who have the chance to work on more than one computer environment, between a Windows-based environment to a Macintosh, Apple Macintosh-based environment, try to open the same document in the now format. Sometimes you are challenged, and you will need somebody to help you to do that, right? Especially if you are a Mac person, and then you go to a place where you have to open it in Windows format, then maybe you are even more challenged at that point. And you will always say the problem with technology. That is a correct assessment, by the way. The problem is with technology, because let's think about the television now. What happened with the television? When you go to buy a TV or a VCR or any kind of operator now, or a recorder or something like that, like a DVD operator or something like that now, do you ever ask about interoperability? Do you ever ask about compatibility? You're just gonna get the best device that your money can buy for you, right? Right? You never say that, are they going to work together? You always assume they're gonna work together, because we, the customers, have demanded from the suppliers to create this working environment that we call it interoperability, that they share the same standards. High definition TV, it's been around for a long time. Only after like 12 or 13 years that Philips decided to go ahead and release one to the market. And then the market reacted by trying to come together and agree on the standards. There are different standards. Now, high definition TV, you never ask that would it work with my DVD player or not. There was a time that it would not, but we as the customers, the clients, have forced those manufacturers to agree on the standards. Unfortunately, in computer technology, we are not there yet. And in healthcare, it is more so than other industries. And that's why we find the healthcare industry is lagging behind when it comes to information technology adoption. Now, the center of excellence is that where we give the chance for those among us who want to work more, who are not required by the same deadlines that we have to excel and find other ways to do the job that we are supposed to be doing. This is quickly the table of contents that I'm talking about. So, what is the center of excellence for us? The aim is to establish business continuity. Again, let me remind you, the data that we collect, because the aim of this entire project, this 12 billion Saudi riyals worth of projects, is to make sure that the patient information is available at the point of care. So we know for now that in the near future, we'll have to change the different technologies by which we are exchanging this information. So the purpose of all of this is the continuity, because we know that there will be a day where we will not know where to go. We'll need somebody to give us a canvas. We'll need somebody to give us direction, to tell us where to go. This is where all that is taking place. So, to keep pace with technology, maximum the usage of hardware, software, and highly skilled personnel. That is very difficult to find, highly skilled. Try to find somebody in the IT business, that's very difficult, very expensive. Somebody in the health IT business, they are only raised and bred in healthcare organization. King Fahd Medical City, National Guard Health Services, the armed forces, the security forces. You can't find them in other places. because that's where they are being trained. Now, we need hundreds of those. And of the lower level, we need thousands of those. What can we do with them? They are non-existent. So we have to come up with innovative way to train those people. It is no secret that although we are benchmarking and we're learning from the different experiences of other countries, and we always try not to start from where others have ended, no, to start from where others wanted to end. Kind of learn also from their mistakes, not only from their successes. Okay, so it is no mistake that we are modeling a lot after the Canadian experience because they have proven that they are more successful. However, when we shared with them our work with the Center of Excellence, especially the incubation of people, the incubation of projects, they said, we never thought of that. We never done it. We wish we have done that probably 7, 8 years ago, so we'd have now ready people, ready products. So that is saying, although we model after them, we learn from their experiences, but we also will learn from other experiences, and the Center of Excellence is the place for us to do that. To create a repository of solutions, reusable components. A lot of things we do and go, and I mean, we now implemented in our 16 maternity hospitals the infant track component, which is called the RFID, the radio frequency identification, that making sure that whenever try to remove the infant from the secured area, doors will be closed and alarms will go off, and or if the child, the infant is delivered not to the right mother, also the alarm will go off. Now, when we did that, it was an easy technology. The challenge now is with the people to adopt it and to use it. This is again where we bring it to now this place, because we want to make sure is that whatever solutions we are doing now, we are going to reuse them. Why? Yes, we have 16 maternity hospitals in Ministry of Health, but we also have 150 hospitals where deliveries takes place. Areas where they don't have maternity hospital, but then the mother will arrive with the need to deliver the baby, so they will be delivered. Also, that's a baby, we have to care about the baby. Now, this reuse is very important for us, and this is the place to do it. Well, we talked about the mission, so I'll just jump to the services. Skilled. We need a highly skilled people. They are limited in availability, and they need also training in the health IT, right? Trying to hire an IT person is not easy, but trying to hire a health IT person is almost mission impossible. So we know this, we talked about it, this is the place to do it. Benchmarking. Like we said, we don't have the time. We spent some time planning, about 1 year. Some people from King Fahd Medical City, Engineer Khalid Salam, Engineer Muhammad Al-Zaidi, certainly Dr. Abdullah Al-Amr was part of our steering committee. Others have participated with us on and off, but we finished planning. Now we can't afford to say we're doing planning, but we need to do planning. We need business continuity, and this is the place to do it, to continue doing benchmarking for the new things that we're doing. Interoperability, we talked about it now, the standards, making sure that we carry them correctly. Process and methodology selection, how are we going to do things? People, they expect you to know it. Well, we are doing something that no other country in the region, when I say the region, I mean the Middle East and the entire continent of Africa, has done something similar. And only few countries have made the bold decision to go ahead and do something similar. So there are a lot of things we're doing for the first time. And when you meet somebody and they come to you and they say, this guy, Muhammad Al-Yemeni, he doesn't know the heck what he's doing, well, maybe they're correct, I think, to some extent. But please, can you ask him on my behalf, do you know what the heck you're talking about as well? Because nobody has done this. We're doing it for the first time in the entire region. And if you know anybody in the region that knows this, please point that to me. And again, we're still hiring. The body of knowledge, okay? We are doing a lot of things. Ask Dr. Fahd here, he's looking at me now, if he remembers the old days of research, okay? Research, research, research. Certainly, if you look at the pillars of the Ministry of Health now, research is a major component. As a matter of fact, we are now in the first steps of creating a think tank for the Ministry of Health, and research will be a major part of that. We can't afford to do research. I mean, people who work from 8 a.m. to 9 p.m. don't have the chance to do research. But we certainly do need research, and that is the place. We'll give them the chance, we'll give them the money, we'll give them the support, and we have plenty of ideas. I mean, if you think you have enough ideas in King Fahd Medical City to do research on them, come and look at the eHealth program. You will be amazed at the number. I can name you now at least 20 research ideas that we have enough material for them, not to take you for a research for a paper, to take you for a PhD. I'm exaggerating. I have 20 PhD people working on the material that we are producing from our program. 20 PhD students that I had the pleasure and the privilege one day to teach them their masters, and now they're doing their PhD in the West. Some are in Asia, but mainly in the West, and now working on material we are producing from the eHealth program. And we can do much more. We are producing things on a daily basis, not even on a monthly basis. We certainly are big on team building and team approach for problem solving. We certainly want to make sure is that we do an end-to-end view of our processes, because we are doing things that we know that we will be repeating very soon, so we make sure we document, and also we want to create a legacy. We know that we are here today, but tomorrow we maybe not we're going to be here. We want to make sure that part of our business continuity is that we do a complete end-to-end view of our processes and documentation for all of them, and from time to time also do the proper collaboration and the knowledge sharing with others. We're already doing that. We've been doing it with the Gulf region. Now also some Arabic countries are asking for us, and the Ministry of Health now is the lead country in the IMRO region, in the East Mediterranean region for the World Health Organization time. That's a very nice way, Doctor. Jazakallah khair. I wish I can finish, okay. Well, I have a lot to talk about. Let me just quickly talk about, these are the main points. Please, this presentation is available here if you want to learn more. As a matter of fact, although I welcome and I cherish the opportunity to be invited by King Fahd Medical City to speak today, but the person who should be here in my place is Dr. Abdurrahman Bashir, because even the person who leads the Center of Excellence, he comes from academia. He actually used to work here, King Fahd Medical City. Some of you may remember him. He comes from academia, and also he comes from business experience. This is the kind of work. We want people who know about academia, know about research, how to do them, know about the intellectual challenge, but also they comes from the work, the deadlines, the deliverables, the budgeting that you have to face. And he should be the person talking about, but I'm just honoring the invitation by King Fahd Medical City. Probably the most important for us are two things: the expert incubation and the project incubation. And we want to make sure is that we raise enough expertise within the eHealth program. And we are open, by the way. We are open. King Fahd Medical City, although it's stand by itself, but King Fahd Medical City is part of what we do. You will find the two teams are kind of like interchanging and working together. But we are also open to other healthcare providers, that we will have more people than our need, and then we will release them to the market as well. Because we know the country needs that. We're looking at continuity for the entire country, not only for the Ministry of Health. Although we represent about 70% of the country at this point, and we regulate the 20% of the private sector, kind of like gives you the question, why should you have other providers? But there is, it's a fact, we have to deal with it. So we're making the availability for everybody here. The other, testing is certification. The providers now, when they come for your PACS, for your MRI, for other services now, can you believe it that these systems still until today, they don't communicate with each other? And sometimes you have to create it in the RFB that they can maintain it. So what we are doing, we are creating the standards, and we're gonna certify them that before you bid on any project for us in the Ministry of Health, that you have to be certified. This is where it is being done for us. The project incubator, you have a lot of good ideas. I just talked about the RFID for the babies, for the tags for the babies, okay? That is a very challenging project to do for us in the Ministry of Health. So what we did, in order to do a research on it, technical and administrative support, and product marketing to tell the people this works, actually, you can use it, or maybe say, you know what? We should pull the plug on this kind of technology because we cannot use it. This is the place. We incubate the project there until the project has enough power, enough wings to fly, and then we say, off you go. Now you go to the business owner to work on it. Simulation center, please, we'll have that available. We are doing 2 massive simulation centers, one for the e-health and one for the physician practices, especially for surgery. They're gonna be state of the art. It's gonna be something huge. I mean, that will have its time. That's when we have the opening, and we'll have the pleasure of having you visit that. Thank you.